Hello and welcome to my health series, your podcast on all things health related. And I'm your host, Florence Odedede. And today we have an important topic to discuss, which is malaria. So grab a cup of tea, sit back, and let's dive into this fascinating yet serious health issue. So malaria is a disease caused by parasites transmitted through mosquito bites and affects millions of people worldwide. But what exactly is malaria and how does it impact our health? So let's break this down. Malaria is like a sneaky intruder. When an infected mosquito bites you, it injects tiny parasites into the bloodstream. These parasites travels to the liver where they multiply and then spread back into the bloodstream. This is when you start to experience symptoms like fever, chill, headache, or body ache. Think of it as a battle happening inside the body. Now, to understand whether you have malaria or not, doctors relies on a laboratory test. Now, this test helps confirm the presence of malaria parasites in the blood. There are few different types of tests that are being used, so let's talk about the two most common ones. The first is a blood smear examination. It is like a detective looking for clues. A small drop of your blood is examined under a microscope, and a trained laboratory professionals search for the malaria parasites. They look for their shapes, size, and other characteristics to make a diagnosis. It is a bit like finding a needle in a haystack, but our lab heroes are experts at spotting these tiny parasites. The second test is called a rapid diagnostic test, or RDT. This is like a quick and handy tool in the doctor's toolkit, and it is also being used in the laboratory. The RDT works by detecting specific protein produced by the malaria parasites. It gives results within minutes, making it a very valuable tool, especially in areas where laboratory resources may be limited. Also, remember that these laboratory tests are essential because they guide the doctor in providing you with the right treatment. Prompt and accurate diagnosis helps in managing the symptoms and preventing complications. Now, let's talk about prevention. How can we protect ourselves from malaria? Well, the key is to keep the mosquitoes afar from us. Mosquitoes are like tiny vampires that carry the malaria parasite. So, avoiding these bites is crucial. Here are some simple steps you can take to keep mosquitoes far away. First, use insect repellent that contains ingredients like DICT to keep mosquitoes far away. Second, wear long sleeve shirts and pants, especially during the peak mosquitoes hours like dawn and dusk. Third, sleep under bed net that are specially designed to keep mosquitoes out. And fourth, if possible, eliminate stagnant water around your home because mosquitoes love to breathe in stagnant water. It's important to remember that mosquito can be a serious illness, but it's preventable and treatable. If you experience symptoms like fever, chill, or flu-like symptoms, especially after traveling to an area where malaria is common, seek medical help. Let your healthcare provider know about your symptoms and travel history so they can perform the necessary test. Always remember that prevention is better than cure. By taking simple precautions and seeking timely medical advice, we can protect ourselves and our loved ones from malaria. And that brings us to the end of today's episode of my health series. I hope you now have a better understanding of malaria and how laboratory tests helps in its diagnosis. Stay tuned for our next episode where we talk about another important health topic. Until then, stay safe, stay informed, and keep those mosquitoes away.